Welcome to Breathe California TV. My name's Terry Trumbull. I'm a volunteer with Breathe California. Breathe California is the lung health organization for the state. We have 6 chapters throughout the state. Last year we helped about 100,000 people here in Santa Clara County with breathing difficulty, and we're going to be talking about some solutions to make things easier for many of you that have had breathing difficulty. We're going to be talking with Charvi Shetty, CEO of Aluna. I met her at a Breathe California fundraiser in October, and they've got a new product to show off. So we'll tell you a little bit more about how many people can breathe easier in 30 seconds.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today. I would not take it back.
Welcome back to Breathe California TV. I'm Terry Trumbull, a volunteer. If you want to help us help other people here in the South Bay, give us a call at 408-998-5865, and there's an awful lot of different things you can do to help the 25-30% of us in the South Bay that have trouble breathing. We help with 13 different types of breathing disorders. Most medical organizations, like our nonprofit, get funding. We recently got a nice grant to help people who've been breathing tobacco. I try to focus our shows on prevention or things that you can do about solving your problem rather than waiting until you have a problem. So we're talking with Charvi Shetty. Welcome.
Thank you for having me.
So you founded Aluna and you're its CEO. Tell us a little bit about what it is and wave your show and tell around a lot.
Yeah, definitely. So first of all, thank you so much for having me here today. And so what the goal for Aluna is to be able to develop a respiratory management system so people with chronic lung conditions like asthma, COPD, or cystic fibrosis can just simply breathe into the device. And we use machine learning algorithms and a gamified app to make users be engaged with their own health and then also be able to manage their own health and see when they're healthy, when they're not so healthy and need to take medication or go see their doctor.
That sounds like a lot more fun than traditional medical monitoring.
Yeah, definitely. So initially we were aimed for it to be for children, which is why we made a cool looking device, and we also made it a game.
So the product actually will send to your healthcare provider information?
So there's 2 parts to it. First, we want to make sure that families at home can manage it themselves. So immediately as you blow into the device, we give you a number which tells you how obstructed your lungs are. So for instance, so you know when you're fine or need to take medication or take some sort of action. And then within the app, like for instance, after or before you see your doctor, you can export your data as a PDF and then your doctor can review it. So it's a more meaningful appointment.
Yeah, I'm perhaps because of my age, I've had a little problem adapting to the changes. My healthcare provider doesn't give me paper on anything. They keep telling me to go online, which I haven't bothered to do to get a password or anything. But this would get this to your doctor pretty quick.
Yep, exactly. And for us, I mean, what some people have done is that you just pull it up on your phone itself. You can just share it with your doctor.
So you got an app for the phone?
Yep, exactly. It's a cool mobile app.
So one of the things that startled me, you and I met in October at the annual fundraising walk that Breathe California has at Hellier Park. 2 or 3 years before on that same kind of event, I did a breath test, and the person administering it said, "Oh my God, you need to see a doctor immediately."
Okay.
And I was very appreciative of that. But it turned out she thought I was much younger than I actually am. And I told my doctor about it and saw these charts that show how badly the older you get, your lung capacity tails off. So thinking that I was 60 instead of 70 made a world of difference.
Exactly. So that's why we take into account your demographics, like your age, your height, your gender, ethnicity. So everything that could potentially impact your lung size even.
So is that allowed for within your machine, or does the doctor interpreting the results have to do that decision making for you based on your height, weight, your age?
So there's already papers out there. So for instance, that compare and take a look at you compared to thousands of other people of a similar age, height, gender, ethnicity. So that's what the doctors in the hospital use with their machines, and we're using the exact same data sets as well. So.
So I remember 15, 20 years ago when Pete Wilson was governor, we got a bill passed to start doing lung capacity testing, and he vetoed it. What problem would that solve? Would you have to be diagnosed with asthma to want to use your product?
Yes, exactly. So our product is intended for people who've already been diagnosed with a disease. So we're not a diagnostic, like we can't tell you whether you have asthma or COPD or cystic fibrosis. It's just a way to be able to monitor your lung function over time, specifically looking at your forced expired volume over 1 second, which tells you how constricted your airway tracts are. So we're taking the gold standard for the care for asthmatics and COPD from the hospital, and we're simply bringing it to the home. So it's kind of like a blood glucose meter for diabetics. So by monitoring your lung function over time, you can look for fluctuation and take preventative action to prevent an attack.
So if I was seeing my doctor, is it possible that they would use this?
Yes, so actually, for instance, in a lot of asthma and allergy specialists, like in the clinics that we're working with here in the Bay Area and throughout California, they do have this kind of technology. And this is an additional way for doctors to be able to understand what's going on with their patients in between those office visits.
So I mentioned Breathe California and its offices has brochures and assistance for 13 different types of lung disorders. Would Aluna work for more than the 3 that you just mentioned? Would it work for some other type of breathing disorders?
Yeah, so actually, spirometry is used for a wide variety of different respiratory conditions. We're simply focused initially on the pediatric asthma market first, mainly because kids have a harder time communicating how they're feeling. And so even though kids only encompass a quarter of the total asthmatic population, they account for nearly half of all hospitalizations and emergency visits. So they're the ones who need it the most, initially at least, which is why we wanted to be able to focus on them.
Yeah, I could see that difficulty. I don't know when kids start to talk. I want to say maybe at the end of the first year, but that's only based on my 2 kids. And they certainly probably can't contribute much of any use that quickly. My wife has severe dementia and could not has quit talking altogether. So one of the problems with dementia is the inability of the patient to communicate with you. But if you could get her to use this test, you could relay some results.
Exactly. Exactly. It's an objective measurement, which is basically something much better than just relying on symptoms or someone else's observations.
So I complained and think I'm orienting the show towards prevention of problems. Do you see much changing in the medical field towards prevention over treatment of the actual problems?
Definitely. I think it's because, I mean, just it's generally known that it's best to want to avoid, for instance, a costly thing like going to the hospital for an emergency visit or being hospitalized. So any action that can be taken to prevent that attack could be very beneficial. Because even when kids, for instance, have an attack, it's not only emotionally traumatizing for the kids themselves and their parents, but they also have to miss very often school, parents have to miss work, and then you have to travel to the hospital to get treated. So it's a disruption of their entire day, or even days perhaps.
Yeah, no, in some ways, as a parent, I appreciated those trips, not the medical ones ever. But the only way I could get my two daughters to talk to me was when I drove them to soccer or brownies or whatever in the world it was. But a kid who's not feeling well is not going to be real communicative.
Exactly. So I mean, like for instance, asthma for children is like the #1 chronic disease for them, and is also the #1 reason why they miss school. A lot of the people who are using Aluna right now are very active. So they play soccer, they do martial arts, they run, and so we want to let them continue just being kids.
So you started Aluna. How'd you come up with this idea?
Yeah, so it started off when all of our co-founders were undergrads at Berkeley. And so one of my college roommates at the time.
What kind of major did you have?
What major? I was a bioengineering student back then.
You know, I'm used to environmental studies majors teaching at San Jose State.
Okay.
Santa Clara, I don't think there's a snowball's chance that any of them would invent something like this. So talk about bioengineering. And
Yeah.
you must have had some other more intense sources that were being used elsewhere in medicine that you adapted.
Yeah, so being at Berkeley, we were very close to University of California, San Francisco as well. So we had access to a lot of the doctors over there. So then we could learn more about the medical problems behind it, speak with the nurses, the respiratory therapists, even the medical students to learn more about the medical perspective of where the needs were. And at the same time, we went out to some of our friends who used to suffer from conditions like asthma when they were younger, spoke to their parents to learn more about what they would have needed to help them self-manage at home. So I learned during my senior year that my college roommate used to suffer from such a severe form of asthma where her childhood memories, like she didn't remember things like going to Disneyland, for instance. All she remembered was going into the ER. Her parents didn't even let her go outside of her home very often because they were afraid that she would have had an asthma attack. So for me, I noticed that she wasn't as outgoing as some of our peers, and I understood that's because of her childhood and what she had suffered through. And so what I wanted to be able to devote my life to was to be able to not have health be something that people have to worry about. So that's why I wanted to devote myself to be able to bring hospital technologies into the hands of people with chronic conditions.